Good afternoon. I'm Dr. Richard Margolin, board-certified family physician with Advocate Medical Group in the Lincolnshire office. I'm here to talk to you today about glaucoma. Glaucoma is a disease of the eye that affects the nerves connecting the eye to the brainstem, and it's usually the nerve gets damaged, causing high intraocular pressure or pressure within the eye itself. The most common type of glaucoma is known as open-angle glaucoma, and it often has no symptoms. What we typically see is that there is generally a slow loss of vision, and then when you go to the eye doctor and they check your eye pressure, we detect it to be elevated. The most common treatments for glaucoma are eye drops, medications, and surgery. If unchecked, glaucoma can lead to blindness and optic nerve damage. The problem with glaucoma is that there are no signs or symptoms that you have to know that you have glaucoma. That's why it is extremely important for you to make certain that you go to your regular doctor, get scheduled for routine eye exams as well as routine medical exams. By getting your eyes checked on a regular basis, if glaucoma is detected early enough, we can treat it with the use of medications. So the question people ask is, well, how do I know if I'm at risk for glaucoma? And we want to let you know that everybody's at risk. Open-angle glaucoma is the most common type of glaucoma. It usually starts in people that are in their 60s or 70s, and it's typically one of the biggest things we see is your vision starts to go. It can be a symptom of vision loss, could be a symptom of many other things like cataracts, diabetes, but glaucoma is always within the picture. Over time, if it's not corrected, the pressure can build up in the eye, can affect your vision, and lead to blindness. Open-angle glaucoma, which is the most common type of glaucoma, causes 2 out of 10 cases of blindness in African American patients, as well as in the general population. Diabetics are at a much higher risk for developing open-angle glaucoma for reasons that we're not 100% certain. So again, I cannot stress to you the importance of getting a routine medical exam. Make sure if you have diabetes, it's controlled, and that we get you to the eye doctor. That's why typically when you go to the doctor and we check you for diabetes, we always say, did you get your annual eye exam? Diabetics who are at high risk for open-angle glaucoma or glaucoma in general need to get annual eye exams. There's also something called normal tension glaucoma. It appears when your eye pressure is normal. And that's typically seen in people who have a family history of glaucoma, of Japanese ancestry, and sometimes we see it in people who have low blood pressure or people who have irregular heart rates. And again, the treatments may be medications or laser treatment. With the angle closure glaucoma, which is called narrow angle glaucoma, it's a medical emergency. You have intense eye pain, red eyes, acute blurry vision, and that is something that needs to be treated immediately. If the fluid builds up in the eye, it causes an increase of eye pressure, which gives you the intense pain. It needs to be drained immediately. Typically, that is drained in the office using a laser. There's also something called secondary glaucoma, which is something that comes by another medical condition. Typically, it comes when there are extra blood vessels that cover the eye, like in diabetes. So again, diabetics need to get their eyes checked routinely. Retinopathy that we see, the loss in vision that we see, all can lead to and cause you to have glaucoma. Unfortunately, as I said before, there is no direct correlation between prevention other than good health, lowering your blood pressure, staying physically fit, getting your diabetes if you have it under control, avoiding diabetes. So again, when they talk about am I at risk for glaucoma, over the age of 60, African American over the age of 40, and I'm not sure why African Americans get glaucoma earlier, or a family history. So let's talk about treatment. The most common treatment are eye drops. They're prescription eye drops. They need to be taken every day as per your eye care provider's instructions. They will not reverse glaucoma. They can prevent it by getting worse. The drops help lower the intraocular eye pressure and help control the glaucoma. Glaucoma is controllable but not curable. Laser treatment can be used as well, as I indicated in the emergent situation. It can also be used electively, again, to help get the fluid to drain better and to keep the pressure down. Laser therapy is typically painless, done in the office or in an outpatient surgery center. If the laser treatments and the medications don't work, then we can do surgery. There is glaucoma implant surgery. There's something called a trabeculectomy, and there's minimally invasive glaucoma surgery. The trabeculectomy is a type of surgery used to treat opening of glaucoma. It takes less than an hour, and they make a special opening in the inner eyelid, upper eyelid, which helps drain the fluid. Glaucoma implant surgery is done in the hospital. It takes a little bit longer. It takes up to 2 hours. And basically, in this case, they implant a little shunt, basically to keep the passageway open for that pressure to be reduced. And the minimally invasive one is a newer approach, and it lowers eye pressure, helps recover faster, and again, is something your eye care provider can discuss with you. So in summary, what I'd like to state is that glaucoma is something we see in elderly people, typically over the age of 60, in African Americans over the age of 40, in diabetics. Heart disease can cause glaucoma, and family history. The most important take-home message from my talk this afternoon with you is that we stress to you the importance of routine eye exams, routine medical exams by your healthcare provider, keeping blood pressure under control if you have high blood pressure, keeping your diabetes under control if you have diabetes, and overall keeping your overall health in the best shape. Thank you.